And after winning a stare down with the opposition last week, the Liberal government was handed a stinging defeat today. A Conservative motion to force the government to hand over pandemic-related documents was passed despite loud objections from the feds. The Liberals warned the level of disclosure would jeopardize confidential negotiations with drug companies and medical suppliers, even going so far as to suggest Canada could lose access to vaccine supplies if the opposition got its way. Procurement Minister Anita Anand issued those warnings. She joins me now. Minister, welcome back to the show.
Hi, David. How are you doing?
I'm good. So you've lost this vote, 176 to 152, despite your dire warnings of the consequences of this motion. If this motion is as bad as you say it is, will you abide by this result? Will you comply with this motion?
Most definitely, David. It's very important for all parties in the House of Commons to work together. And as a government, we will do that. And I look forward to continuing the work of the committees and abiding by the terms of the motion. I need to now go back and speak with my team, as do the other ministers that are mentioned in the motion. And as a government, we need to make sure we're complying with it.
This morning, when you and Minister Duclos spoke to Canadians, you warned that this could potentially threaten Canada's access to vaccine supplies. It could threaten your ability to get badly needed medical equipment. If the stakes were so high, why wasn't this a confidence vote today?
We have heard from Canadians that this is not the time for an election. And in fact, we want to work with all members of the House of Commons because we are in a second wave. We need to make sure that it's all hands on deck in the House of Commons and across the country so that we can all come through this pandemic together and out the other side.
But Canadians may not want an election, but I haven't seen much polling on this, but I'm pretty sure they want a vaccine. I'm pretty sure they want PPE for essential workers and for themselves. If this motion really threatens access to those, why don't you take that step? I mean, you did it last week over a committee. This seems like a more fundamental issue for the country at this point in time.
What's really important for me as the Minister of Procurement is to make sure that our contracts are in place with our PPE suppliers, with our vaccine suppliers, with our rapid test kit suppliers. And so now that this motion has passed, David, it is very important for us to make sure those suppliers know that we will do our very best to protect their interests. Certainly where legal obligations will prevent us from making disclosure, for example, that will be something that we need to reinforce.
So in terms of protecting suppliers and their interests, one of the issues in this was who would do the redactions of the various documents you're going to have to turn over to the Health Committee. The motion calls for the Law Clerk of the House of Commons to do it. You wanted the Privy Council Office to do it. Do you trust the Law Clerk to protect the interests of suppliers?
Listen, we are just fresh off the vote, and I have every faith in the Clerk of the House of Commons and his expertise and the expertise of his team. But as I said, we just came out of the House of Commons, just came out of the chamber, and really need to take this back and discuss it as government to make sure that we're in compliance.
We've seen some letters in advance of this vote from companies like Pfizer and from manufacturers and other groups warning of the consequences of this. Has anybody flat out told you that they will walk away from doing work with the Government of Canada on any of these procurement issues if this motion were to pass?
The reach out that we heard this weekend was across the board, from suppliers, from exporters, from manufacturers, from doctors, from the vaccine task force, from the immunity task force. And there's no question that there's concern in the market about the implications of this motion. But the most important thing for us now is to continue to protect the health and safety of Canadians, to continue to procure the PPE and the vaccines. And so we are moving in that direction now to make sure that we're able to reassure our suppliers in the interests of Canadians, in the interests of our frontline healthcare workers, that we will continue to do the job we need to do for Canadians.
The Conservatives have suggested that some of the concerns we've heard from suppliers was solicited by your government, that you reached out to them to flag concerns, and that amounted to fear-mongering. Was there any outreach from your department or any other department of government to get outside groups or third-party suppliers to weigh in on this?
The term fear-mongering is very unfortunate, David. I would say that it is incumbent upon us to maintain positive relationships with our suppliers so that we can be assured of vaccines for Canadians, for example. And so in response to questions and concerns, by all means, we had to have those conversations and make sure that we were answering questions about the implications of the motion, which is exactly what we did.
But in any of those conversations, did any of these organizations or suppliers say to you that this is a line in the sand, that if this passes and if this is implemented and if this level of disclosure will happen at committee, that they're no longer going to work with the government on the pandemic response? Has that explicitly been stated?
David, these negotiations with our suppliers, including our vaccine suppliers, are ongoing. And in the interest of protecting those conversations, I cannot answer that question point blank. What I will tell you is that we are making sure that we keep strong relationships with those suppliers. We've got to continue to make sure that we have those 7 vaccine agreements in place, that we are able to continue to procure PPE as we are in the middle of this second wave. The negotiations for rapid test kits and for PPE and vaccines, they're still continuing. And we are going to keep making sure that we are protecting the health and safety of Canadians.
So what do you do if someone says this is a bridge too far? As you warned this morning, you said you didn't want to be there and tell people you've maybe lost access to vaccines or therapeutics or anything else because of this. What do you do as minister if Pfizer, for instance, or another company says to you, we're out, this is too much, we're not going to work with you anymore?
We are making sure that we will have the conversations with our suppliers to assure them that we will take all precautions necessary to protect their interests, their legal interests, and their interests in their proprietary commercially sensitive information. Those conversations will need to be had in the coming days and weeks, and we will make sure that we do them, David, because as I said, the only way that we have been successful in our procurements in our 2 billion items of PPE procured, for example, is because we have continual outreach with our suppliers, and we are going to make sure that those relationships stay intact for the benefit of our country.
Just one last question before I let you go. Your warnings today on the consequences of this were pretty stark. Why do you think the opposition didn't buy it?
I think that the opposition believes that we are not committed to transparency, and I would say that is false. Over the course of the last number of months, we have made information and details relating to $6 billion worth of contracts available on our website. I have appeared at committee three times. I have also cooperated, and my department has cooperated with requests that have come forward. And I want to also indicate that we have provided hundreds of pages of documents to opposition and to the committees because of requests that have come forward. So we are committed to transparency, but we're also committed to protecting our supplier relationships. And that's a fine balance to strike. And it is clear that we have different threshold points at where you strike that balance. But now that motion has passed in the House of Commons, it is incumbent upon all of us to ensure that the terms of that motion are upheld.
Okay, Minister, thank you so much for your time.
Thank you so much, David. Take care.
Okay, so let's turn now to the opposition's take on today's motion. We've reached 2 health critics. Michelle Rempel-Garner is the health critic for the Conservatives and the author of this motion. She joins us from Ottawa. Don Davies is the NDP health critic joining us from Vancouver. Welcome to you both. Thank you so much for making the time. Ms. Rempel-Garner, I'd like to start with you. Your motion passed fairly decisively, 176 to 152, I believe. What if the government is right, though, that the level of disclosure you're calling for here could cause potential suppliers to walk away?
Well, the one thing that the minister is right about is that the health and safety of Canadians is in jeopardy right now. And I mean, that's fairly obvious with the numbers that we're seeing with regard to increases in cases in coronavirus. So that leads to questions like, well, why hasn't the government produced enough rapid tests yet? When are those rapid tests actually coming? When will they be in widespread use? Who gets them first? And the same questions go for vaccines. We don't have clear answers on where Canada is in terms of the order of getting vaccines if they are available. Basic questions like that that will protect the health and safety of Canadians. And it's actually the job of Parliament to find that out. We are in the middle of a second wave, and we are still only relying on economic shutdown as a way of addressing the pandemic. And that's not good enough after 9 months. So we need to understand what's been done to date, what went right, what went wrong, and change things going forward. Now, with regard to the specific criticism around it, it's completely bunk. In the motion, there's a great degree of safeguards written in to allow the law clerk to redact information on a bunch of different criteria. I would be willing to have the law clerk come to our committee to talk about that process. There's a million different ways that we can address these things. I think what happened today, especially since the health minister on Friday was saying that she was supportive of amendments that we made to the motion, I think that the government realized it was going to pass. I think that they're pre-positioning potentially to not give us the documents or to potentially go into an election, and that does not protect the health and safety of Canadians. I do think that this was a very good exercise of collaboration between the opposition parties on working to refine the motion. I have to give my colleague who's on the panel with me a lot of credit, Don Davies, a skilled parliamentarian who did a lot of work on it. I have no concerns outside of just being very excited that we are going to finally get some answers after prorogation, the shuttering of Parliament, and Liberals blocking committee, and hopefully have a better plan for Canadians to address the pandemic.
Okay, I do want to point out that Minister Anand did just say they would comply fully with the motion and that they do not believe Canadians want an election.
See.
So, we will see. But Mr. Davies, on the point that the minister has raised, I mean, if this does cause a supplier, groups like companies like Pfizer have raised concerns about this, and she did warn today that she's afraid this could cost access to vaccine supplies. If that happens, is that the price you're willing to pay for this level of disclosure in the middle of the second wave? Because the argument has been wait until a little bit further in the process to do this level of examination.
Well, again, like Michelle, I don't accept the premise of that question. I don't think that it's a real that we have to choose between transparency and accountability and making sure that Canadians get access to timely information and timely medical services. Look, if you read the motion, I think the answer is right there. We have asked for disclosure in 4 specific areas: personal protective equipment, vaccine development, testing, and early pandemic warning system. And a lot of those are just since March of this year. So it's a discrete time period, and it's discrete areas that we want to look into. And there are 4 areas of redaction that I think adequately protect the government and meet those concerns, including national security and interference with contractual negotiations. Mm-hmm. So the government can easily redact information that may be commercially sensitive, yet they're going to go out and scaring Canadians and worrying Canadians that by being transparent and accountable to the health committee, their health is at risk, when we specifically built into the motion.
Well, just help me with something on that. Can the government do that redaction, or does it have to turn everything over unredacted to the law clerk and leave it up to the law clerk? Is that not the process?
Well, I can't think of anybody better or fairer or more objective to do the redaction than the law clerk. But we've given the law clerk the criteria that the law clerk needs to meet the precise concerns that Ms. Anand and the Liberals are stating. So, they're exaggerating the problems, they're scaring people, and they're trying to get out of transparency and accountability, which is the role of the Health Committee. Plus, I just want to say that the Health Committee has done an excellent job over 5 years providing positive recommendations to the government. We need information to do our job, and this government, for some reason, doesn't want to give us documents that are necessary to do that.
But Ms. Rempel-Garner, it's not just the government raising concerns about this disclosure. Pfizer, as we mentioned, one of the companies with the vaccine agreement, they've had concerns. So have some of the PPE manufacturers and even doctors like infectious disease specialists like Isaac Bogach, Dr. Zane Chagla. They've all said that there will be time for a review later. And right now, the focus needs to be on the current response. What's your response to what they've had to say about this?
Well, as a parliamentarian, the current response doesn't seem to be going particularly well. I mean, Premier Legault was out this afternoon announcing, very severe issues in Quebec, same with Premier Ford in Ontario. There's a lot of people who are concerned about their businesses, their health and well-being, social isolation, and just something as basic as why does Canada not have widely available rapid tests? When are those coming? That's information that has not been forthcoming from the government, and we need that information. So it is the role of, I disagree, it's the role of Parliament to oversee government policy, to hold them to account on doing better, and also to making sure that we're getting value for money. We've spent billions of dollars. There's PPE that the government has ordered that we don't even know where it is or who got the contracts and why. And we should be looking at issues like that. That's normal. It's healthy. And as Mr. Davies said, the law clerk has the ability to look at this. I do think this was fear-mongering today. And if the government has nothing to hide, then there's nothing that they need to be worried about. And I don't think companies need to be worried about either. I think the government did phone some companies this weekend and tried to, fearmonger a little bit. I don't think any company should also think that they wouldn't be subject to, to scrutiny of taxpayer funds. There's normal processes for that, which also respect confidentiality. And I think this is a very positive motion and outcome for all Canadians.
Mr. Davies, how do you respond, though, to those concerns raised by industry and manufacturers and also some of the doctors who have been helping Canadians throughout this entire process?
Well, with great respect to them, I don't think that parliamentary accountability is inconsistent with an effective public health response. In fact, I think that it's required. I've seen the Health Committee, we've been studying COVID since March of this year. And this motion before the House is no different. It doesn't change a single thing in terms of how we've been looking into COVID issues from the very beginning, other than there's some production requirements here. And, I want to point out, it's my understanding that Donald Trump's U.S. has already released a contract with Moderna. I mean, there's some appropriately redacted information, but they've released a vaccine contract. And I think Pfizer is one of the companies that has just been exposed as giving access to the U.S. 3 months earlier than Canada gets. So these are the kinds of questions that I think we need to look into. And we're responsible parliamentarians. Michelle is, we are. We understand that there are sensitive parts of these motions. That's why in the motion itself are built-in protections for national security and protection for contractual negotiations. So I think we can do our job, get the information we need, hold the government to account, look into these very important issues. And this is not to look in the past. This is for the future. I'm motivated, and I'm sure Michelle is, to get current information so that we can plan to get the best possible results for Canadians today and moving forward. But we can't do that if a government refuses to give us any documents at all. And that's been their position so far.
Ms. Rempel-Garner, just a final question on the issue of getting those documents. Dr. David Naylor specifically said he is concerned about civil servants having their focus on producing these documents rather than on responding to the pandemic. And he points to the fact that the Auditor General is currently conducting a review of pandemic preparedness and response. So why not just wait for the Auditor General report if it could create a problem for the public service, as Dr. Naylor suggests?
It's interesting because in response to questions on an article last week that showed that I believe it was half of federal employees that had the function of producing documents for information requests were actually essentially not being utilized right now. The health minister, to questions I raised in the House, said that nobody had ever asked her for information on this. And that's just patently ridiculous. It's a very bourgeois view of what Parliament's function is. And I know it might be difficult for some people who are used to, under the Trudeau Liberal government, existing without parliamentary scrutiny because the government has been very recalcitrant in putting this information forward. But the reality is that the Liberal government did not receive a majority mandate. They received a minority mandate. And the majority of parliamentarians voted in favor of transparency to do exactly what Mr. Davies said, chart a better path forward that allows us to get out of this crisis without having to keep closing businesses, putting people's health and safety at risk, isolating people from their loved ones, and worse. So again, I'm hopeful that this information will allow us to chart a better path forward, and holding the government to account is what healthy democracies do. This is normal. The fact that we're considering this not normal, to me, is a problem in this country, and I'm very excited and happy about what Parliament did today.
Okay, we're out of time. We're going to have to leave it there. Michelle Rempel-Garner, Don Davies, thank you so much for your time.
Thank you.
Thank you.
New Democrats scored a historic victory in British Columbia over the weekend. The party is projected to win 55 of the province's 87 ridings. The results won't be finalized until more than 500,000 mail-in ballots are counted in November. But already there is fallout for the provincial Liberals. After losing seats and vote share right around the province, Leader Andrew Wilkinson said just last hour that he is stepping down. Joining me now with more is BC Provincial Affairs reporter Tanya Fletcher in Vancouver. Tanya, exciting few days for you folks out in British Columbia. Let's talk about Saturday's results. What did those and Wilkinson stepping down as leader say about the state of the provincial Liberal Party right now in British Columbia?
It's really reflected, David, where this party has gone over the past 3.5 years as it's newly been in opposition in this province. This was the worst result for the BC Liberals in nearly 3 decades in this province. You know, they lost 12 seats. It's their worst seat count since 1991. And not only that, because of course we know a few key ridings can swing and make all of the difference, but a greater reflection is the overall popular vote, the vote share. They lost that in every single region of BC, and that really is telling. It's why, you know, the night of the election, the BC Liberal leader gave a not quite concession speech. He tweeted out on Sunday at 5 p.m. that he called John Horgan to congratulate him. And now today he announced his resignation. It was 97 seconds in total. His statement to the media, he took no questions. And here's part of what Andrew Wilkinson said just an hour ago.
Leading the BC Liberals has been a great honor, but now it's time for me to make room for someone else to take over this role. I've asked the party president to work with the party executive to immediately determine the timeline for a leadership selection process.
So his message throughout this campaign was centered on law and order. He really leaned to the right and tried to leverage, crime and homelessness, and often conflating those things with addictions. That message really didn't resonate. And you even look hyper-local. You zero in on specific ridings, like in Surrey, for example, where they tried to leverage pre-existing issues. The city of Surrey had decided to get rid of the RCMP in favor of a municipal police force. The BC Liberals promised to hold a referendum on that to try to leverage some of the opposition and the anger against that. Didn't resonate. They in fact lost a seat in Surrey. So you look at where their message just fell flat and they didn't connect with voters. And more broadly speaking, that drives home the point of where this party goes. It is in a reckoning. It is having an identity crisis, and it needs to figure out where they go from here. At the crux of it is figuring out the dissonance between trying to keep the right of center, more conservative, small c conservatives happy, while still trying to move forward and carve a new path to attract younger, more moderate progressive voters. Just a moment ago, I got off the phone with who was going to be kind of a leadership successor. His name was at the top of that list. He lost his own riding. And so he said, he didn't rule out still a leadership potential run in the future, but he was very candid now in saying that this party over the last 3.5 years had a chance to rebrand itself, and it didn't. It failed at that. He said they've been trickling away the urban vote. Over the years, they've gradually been losing those urban votes. And he said on Saturday, that trickle turned into a tsunami. They really need to figure out how to paint a new path forward, and they haven't been able to do that under the leadership of Andrew Wilkinson. He was clear in saying that the party doesn't reflect the diversity of BC in age and in, visible minorities. He himself said that was a very clear turning point for this party, so that's where they need to go from here.
Yeah, which all explains why that lasted 97 seconds with no questions earlier today.
Yes.
Okay, but on the other side of this, the results are pretty strong endorsement for the NDP, their leader, the re-elected Premier John Horgan. What are some of the significant places that party won over voters?
Yeah, well, you just have to look at where they won, right? Traditional Liberal fortresses and some very surprising seat flips. You look at Richmond, for example, which has been long Liberal, BC Liberals. 4 ridings there all have been Liberal red for decades. This time around, the NDP managed to flip 3 out of the 4 there. You move further east into the Fraser Valley. It's really these suburban seats in Metro Vancouver. In the Fraser Valley, which is the epicenter of the Conservative vote, it looks like, once the final ballots are in, it looks like they've lost all 4 seats combined in Langley and in Chilliwack. So that tells us a huge message about where voters are at. The caution, though, for John Horgan is this simply a pandemically tailored election result? Could they have run on, it didn't matter what their platform is. People wanted a stable, steady hand. They had that in the NDP before. They largely ran on Dr. Bonnie Henry. So was that just simply a result on let's keep the status quo? We asked John Horgan this yesterday, and specifically I asked him how he's going to keep everybody in this party happy now, because they did sway some traditionally right-of-center voters for the first time. How is he going to reconcile that with still appealing and keeping happy his more traditionally progressive left-of-center base? Because this is now a very broad tent, and here was John Horgan's answer to that.
It's a tent that I deliberately constructed. I believe that New Democrat values are mainstream values. My values are from Langford, where my neighbors have been. I've lived in the same house for a quarter of a century. I've got a hockey net at the bottom of the driveway. I've got a bus driver down the road. I've got seniors. Those are the people that I see every day. And they don't think of the world left and right. They think of the needs of their family, the needs of their community. And I think that's how you build big tent politics, is responding to the needs of people. And that's how I'm constructed, and that's how I'm going to keep going.
The challenge now for his NDP majority is making gains and keeping the rest of BC engaged, because there were some swing ridings in more rural areas of the province that they had a shot at. It was within reach, and they did not flip them to the NDP. He admitted that. He said this majority will let him get out of, the urban centres more and into BC, where forestry is still a huge concern, for example. But in Metro Vancouver, in the urban and suburban areas, the challenge will be delivering on his promises. If he did sway some votes by, for example, transportation issues, he promised to widen Highway 1 through the Fraser Valley, extend a SkyTrain all the way to Langley, which he needs federal funding from, by the way, to do that. So he's going to have to deliver on those promises. And we have a giant tunnel here that needs to be replaced. The NDP, since they've been in government, have kind of booted that down the road. They're now going to have to deliver on those promises, because that's what they campaigned on. And those newly NDP voters will be depending on them to do that. And one last point I want to make is the BC Greens. They're no longer bound by their power sharing agreement, their CASA deal with the Greens. And so that will be a challenge as well. The Greens will have to try and find some kind of relevancy in the legislature. Site C, environmental issues, climate change. How is the NDP still going to satisfy those Green voters under their orange wing now, because they don't have the BC Greens holding that balance of power in the legislature to do that? David.
Okay, Tanya, we're going to have to leave it there. Thank you so much. That's the CBC's Tanya Fletcher in BC.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.